I wonder if you feel like all the at-home tests are being officially reported or not, because we see so many cases of Omicron repeatedly being reported, and it doesn't seem to cease. It doesn't seem to come to an end, right? We keep hearing about hospitalizations numbers going on the rise side, and we feel like, what's going on? We're getting more people vaccinated. We're still wearing the masks, yet we see all these tests, yet we see all these new free masks, and we still see numbers continually on the rise. And that seemed to be the forecast for the next few weeks, at least, right?
Well, that's right. I mean, we're still in the middle of our Omicron surge. And so this is a variant of COVID that is very infectious. And as such, it will infect people in our population very quickly. And then there won't be anybody to infect. So it will disappear, hopefully quickly as well. And we've come up with Omicron, and it looks like we peaked earlier in January, and we're starting to come down with Omicron. Our hospitalizations have stopped going up, they've flattened, and our expectation is that this week, they too will start to go down. If you're unvaccinated, you're still at risk for hospitalization. And when I speak to my colleagues who work in the hospitals and take care of people in the hospital, I ask, who are these people that are so seriously ill with Omicron that they end up in the hospital? And they say they are first and foremost people who have not been vaccinated. They are people who are overweight and who are obese. They are people who have diabetes or heart disease. And so the patients who are most ill and in the hospital are unvaccinated, overweight, obese, diabetes, heart disease. And so if that sounds like you or a family member, then please go get vaccinated, because you are the group that ends up in the hospital today. And we will have people hospitalized over the next month because of Omicron. And even with it coming down, it's so widespread that there will be a lot of hospitalizations. Now, it sounds maybe when I say that, why get vaccinated? Because it's still spreading. But recognize that if you're vaccinated, you're much, much less likely to be that hospitalized person or in the intensive care unit. Mm-hmm. So even though you might get a case, it will likely be mild and you won't end up in the hospital. And nobody wants to be in the hospital. Nobody wants to be that seriously ill person. And so it's important that you get your vaccine. So even if you get it, it will be a milder case for you. So yes, things are coming down with Omicron. There's a lot of home testing, which is great. Our state of Colorado was the first to send people home tests, and we've been doing it for months. And now the nation is making it available for everybody as well. It can be very helpful to be able to just check yourself when you have symptoms to see if indeed it is COVID. So I recommend you get online with the national system to get free COVID home tests. And I think we still have some as well, so you can order them for us as well.